Hey friends, welcome back to Mexic Can, my channel where I talk about all things related to mine and Jim's experience leaving Canada and immigrating here to Mexico. So this week I'm talking about all things healthcare. If you tuned into my first video, you would have got the goods on just the public healthcare system versus the private healthcare system versus how you could just access some primary care through the pharmacies. But today I want to talk about more of our personal experience accessing the private healthcare system here. We do have Jim's folks live down here. My mom spends the winter down here. And because of going with them, we have accessed quite a bit of private healthcare here in the city. So I just want to share some of the things that have really stood out as big differences of what we're kind of used to in Canada. So the first big difference is just how you communicate with your doctors here, whether that's a specialist or just, a GP or family doctor. All of the communication is done through WhatsApp. There's no secretaries, there's no admin assistants. If you have a question for your doctor, you want to reach out to them about something or schedule an appointment with them, everything is literally done through WhatsApp. And we have just found that to be such a breath of fresh air that, in the moment, if you have questions about prescriptions or things like that, it's just so easy to get in touch with your doctors and get kind of immediate responses. So that has been a really wonderful experience. The second thing that was really surprising for us is how much house calls happened here. Like it's a normal thing that if you would prefer to see your doctor at home, they absolutely make house calls, but not just the doctors. Like if you need an x-ray or if you need blood work or if you need an ultrasound, they'll come to the house. If you need physiotherapy, they'll come to the house. If you need to see a psychologist, they'll come to the house. There's just this culture here of we'll go to where you are to deliver your healthcare. Do you pay a little bit more? Of course you do. They're coming to your house, so you're going to pay a little bit more of a premium for that. But we've made great use of that service, and that too has been a breath of fresh air. The other thing that's really different is the length of the appointments here. So, you'll have an appointment with, in our case, the family doctor for our folks is a geriatric specialist. He's a wonderful man. The appointments with him go from anywhere from an hour to up to 2 hours. And it's been our same experience with a dermatologist, cardiologists, neurologists. There's just a more thorough, careful, patient-centric approach to delivering healthcare here that has been really a breath of fresh air. And I appreciate that it's a private system, so we're paying for that service. But I also think that keeps things very competitive amongst the folks that work in healthcare here. And if you want to gain a lot of patients, you have to deliver an exceptional level of care. Otherwise, there's so many choices for you to go elsewhere. So we have really, really enjoyed just the thorough nature of patient care. You don't ever feel like you're just a number on a list of people that the doctor needs to get through that day. You don't feel rushed. You feel listened to. So we have really, really enjoyed that. The caliber of the healthcare system here, we've been into a number of hospitals, a number of medical buildings, and everything is like just, state-of-the-art equipment, really clean, state-of-the-art hospitals. Everything is absolutely up to the standards, if not better, than we were used to in Canada. And English is spoken everywhere here. I appreciate, again, it's because we're in Mexico City, and it is a massive hub for medical tourism here, especially folks coming from the US and a number of folks coming from Canada. So there is a lot of English spoken here. And I actually believe, Jim and I work really hard at Spanish. I'm going to do a whole separate video on that shortly. We're at the conversational level now, which is fantastic. But conversational and medical terminology are two different things. So we've really appreciated that everybody speaks a pretty good level of English here from a healthcare perspective. We haven't had any issues with that. And in the hospitals too. More common with the doctors in the hospital than with some of the nurses. But it absolutely hasn't been an issue for us, and there have been a couple of stays in the hospital for family members, so we do have a lot of firsthand experience there. From a cost perspective, an appointment with our geriatric doctor or a neurologist or a cardiologist has anywhere from about $100 to $150. But again, it's like an hour to 2 hours at length. You really feel like you're getting an exceptional level of care. So it feels like a really great price to be paying for that level of care, that time, that commitment from them. So we haven't found the prices to be outrageous. We had a trip to the hospital through the emergency room where we needed an MRI, we needed a CAT scan, we had full blood chemistry, we saw a neurologist, a cardiologist, an internist, all in the span of this kind of 5-hour window. Just for a little context, that cost about 1,100 Canadian dollars. So if you have insurance, obviously that's just, paid for through your insurance. But even if you're paying out of pocket, I think that's really reasonable. So yeah, I think that's been great. The dental care has been fantastic. I have a great dentist in the neighborhood. I walk to see him. There's no hygienist here. It's actually the dentist that does your teeth cleaning, that takes all the x-rays. And it's about $40 is what we pay for x-rays and a full teeth cleaning from an actual dentist with like state-of-the-art equipment, like everything that you're kind of used to back in Canada. So it's been really terrific. And like even the vets, like we have an amazing vet, her name is Cece. Even she makes house calls. Like we had 2 senior dogs when we moved here. She would come to the house, and like it's not uncommon. So everything just feels a little bit more patient centric here, and for the furry critters as well, patient centric. So yeah, it's been a really great experience. I appreciate that it's private and you're paying for that. I did talk about the cost of our insurance in my previous video this week. So yeah, you do pay for it, but because there is the private and the public sector healthcare, it's very, very competitive. And it's just been our experience that because it's very competitive, the level of care, the patient wins because you have to deliver a really good level of care to your patients so that you get recommendations and referrals and you can build your practice. So yeah, that's just been our personal experience. If you have questions or comments, or you're looking for something a little bit more specific, feel free to leave me a comment or send me a note. Like I said, I'm happy to help and answer any questions that you guys might have. And thanks for joining me today, and I'll see you guys real soon. Take care.